Did you know that about 1 in every 10 Ohioans suffer from asthma? That's more than 1 million people. But what causes it? How can we prevent it? And what can we do to manage the condition? Dr. Jwayyed of Buckeye Health Plan is here to discuss it. Thank you so much for joining us, Doctor.
Thank you for having me.
Now, I know that asthma can cause trouble breathing, but what is the condition?
So asthma is a chronic health condition that results because the airways in your lungs, the little tubules, typically become inflamed when they're in contact with like an allergen. The tubules become inflamed, and then what happens is they sometimes fill up with mucus, and basically the tubules narrow and the patient suffers a sense of shortness of breath and a lot of wheezing. And the treatment is designed to kind of help those tubules expand again and get rid of the mucus.
Now, I know that chronic conditions could be difficult, so tell us how asthma impacts Ohioans' lives.
So asthma, as you mentioned, is very common and very prevalent in Ohio. We know, for example, that for black children, they're much more likely to have to go to the emergency department for asthma care than white children. Asthma can result in people missing work, missing school, missing family activities. Asthma can be a condition that, if it's not treated appropriately and emergencies aren't managed actively, can result in hospitalization. So we're trying to raise awareness for the appropriate need to have your asthma well controlled to avoid asthma-related emergencies.
And speaking of raising awareness, what steps could be done to prevent someone coming down with asthma?
Well, an important step is that, one, we want to make sure that patients keep their annual health checks with their providers. That's very important. Some patients think that if they're feeling well, they don't really need to see the doctor. We want to kind of dispel that myth. Typically, asthma is managed with 2 or 3 medications. One of the medications is typically a controller, a medicine we call a controller that you take every day. It's usually in the form of an inhaler. And the idea behind the controller is it cuts down on the inflammation in the lungs so that you don't have an asthma attack. But if you have an asthma attack, a second medication is usually prescribed, and that's considered a rescue medicine that's designed to kind of treat the acute asthma attack. So we want to make sure people have access to their physicians, go see the physicians when they're feeling well, and make sure they have access to their medications. And also avoid, if they can, avoid the common triggers for asthma, such as dust, mite, and other allergens.
And Dr. Jwayyed, as Buckeye Health's medical director, tell us what Buckeye Health Plan is doing to help Ohioans with asthma.
So as one of the largest Medicaid managed care plans in Ohio, our goal is to improve the health of Ohioans one person at a time. And one is having segments like this where we raise awareness of important topics like asthma, that we encourage members to, again, make sure they see the doctors, make sure they have access to their medications. And also recognize that for our plan and many other plans, patients have access to folks like care guides, care managers who can help them find providers, help them make appointments, help them get transportation to make sure they have good outcomes for their asthma. We have a program called Healthy Homes, and the Healthy Home program is designed to identify asthma triggers that might occur in the home, try to remove those asthma triggers. It's also designed to make sure that members and patients have access to providers, access to their medications, have an active asthma action plan that tells them what to do if they start having exacerbations with their asthma, and then to basically connect them to services and other therapies that would help give them the best asthma care possible.
And I heard that Buckeye Health Plan has incentives for those who continue to keep going to the doctor.
That's correct. So we have something called Healthy Rewards, and basically if you keep your appointments, go see your doctor, do some other things, there are rewards that you can earn, and those rewards can be used to, for example, buy personal care items and buy healthy foods.
Thank you so much for joining us, Dr. Jwayyed. And for you to learn more about Buckeye Health Plan and how they can help you with asthma, just visit their website, buckeyehealthplan.com/asthma.